I had to get healthy to lose weight and not the other way around. Months before I decided to see Dr. Mortensen, I was struggling with these mysterious symptoms. They started off really with small patches of hives or like a small spot on my face that would swell up. And then as the time progressed, it just was happening every single day, and it kind of got really worse. Every single day was something new, or it was like a larger area on my body that was covered with swelling or itchy hives. So those happened out of the blue, but even years before, I was struggling with stomach issues, migraines at least once a month. I was struggling with cystic acne and just a lot of random aches and pains that would happen, like, oh, my back hurts. And then months later, another part of my body would hurt, and then that would disappear. I went to Kaiser for the hives and the swelling. And like most people, the doctor assumed it was allergies. So on the spot, he asked, so what do you think you're allergic to? And so I just kind of quickly went through about 5 to 10 items that I thought I was allergic to. And that's what he tested for. And then I asked him, why is this happening? And he said, well, sometimes these things just happen and we don't know why. And then, so that was my second to the last visit with a Kaiser doctor. My very last visit, and then he sent me off with an EpiPen and antihistamines. So I was taking that, and so I had a follow-up appointment with another Kaiser doctor, and her recommendation was just keep taking the allergy medicine and, of course, lose weight, because that was always kind of the medicine to everything. Everything will go away, just lose weight. I asked her too, why am I taking this allergy meds and not this one? And she just oh, it doesn't really matter what you take. Some people switch between different medications and just whatever you want. And so it was just always kind of we don't know, just do it and lose weight. It is hard work, but it's easy when you have data, when you get feedback, actual objective data, the things I'm doing is working and my body is going towards optimal, that's what kind of always is in the back of my mind. So I found Dr. Craig out of desperation. So the hives and the swelling happened like clockwork. I knew what time of day it was going to start, around 4 in the evening time, and then it would clear itself out the next morning. This was before the allergy meds, but one time it happened during work, and my coworkers noticed. They were like, what's going on? And I thought it was just a feeling I was having, but my coworker was writing her report, and she just looked at me and she's like, your lips are swollen. And so my other coworker looked over her monitor and was like, please do something, see someone, because I just completely lost trust in doctors. So remembering a conversation I had with a friend months ago, and she's like, oh, I saw a functional medicine doctor and he said I had this and that. I'm like, what's a functional medicine doctor? And she explained, and I just kind of dismissed it, but obviously it's stuck in my brain. So after that incident at work, I Googled functional medicine doctor near me, and Dr. Mortensen's name came up. So I just clicked on his name, oh, it's not too far from where I live. And I looked at the Google reviews, and a lot of the patients sounded like me. A lot of the common themes were mysterious, strange symptoms. And, I got well within 6 months or 12 months. Or I finally found out what was wrong with me. It was all the things that were what I wanted and things that I was experiencing at the time. So that's how I made my phone call to the office. Working with Dr. Mortensen is a completely different experience from working with doctors at Kaiser or like in the conventional medicine world. I feel like my first session with Dr. Mortensen, I felt like I was in therapy. It was so strange to be able to talk to someone at length about, my life now, what has been going on since birth and present. So it felt very kind of therapeutic just being able to talk to someone and then having someone listen, not rush through the process, ask questions, allowing me to ask questions and not being dismissed. Like everything had an answer to, what was going on. I didn't feel like I was crazy. That was the first time. I didn't feel like I was crazy. Dr. Mortensen is super friendly, super warm, like I said, easy to talk to. If I don't understand something that he's explaining to me, like with my labs or something that's happening in my body, he explains it through analogies, or his sketches are super helpful. And what I think helped my process was him inviting my husband to my very first session after meeting him. So my husband was there to review the labs, and my husband understood everything that was going on with my body, and I think that's what really helped him be like, okay, I am with you, I'll make the changes with you. We'll change our diet together. Let's do this together. So the very first meeting was just getting to know me. He recommended supplements to start right away just to ease a lot of my issues that were going on until we got to meet again. And typically it's, talking about what's going on and then reviewing my labs and then kind of deciding together what the next step would be. I also want to point out that none of my sessions ever involved talking about my weight, talking about weight loss, taking my weight, or blood pressure. So that was the very first time. I remember like the first time I was like, this is the strangest thing. And I asked him later on, like, why didn't you take my weight or my blood pressure? And he's like, that wasn't what was wrong with you. So that was really eye-opening. The thing I like most about working with Dr. Mortensen is how easy it is to address my questions and concerns with him, and how open-minded he is. I never feel ashamed of what I'm about to say or ask. With Dr. Mortensen, there's never a stupid question. So it would be definitely just the ease of talking to him and just working with him and always getting answers. Like I'm never coming out like, like I always know exactly at the end of my session what's happening and what's going to happen next. Since working with Dr. Mortensen, I've experienced a lot of health improvements. So I initially came in with just like the physical, like obvious symptoms, but through testing, I found out that there were a lot more other things that were going on. So I had no idea that I had prediabetes. So since working with Dr. Mortensen and healing, that has reversed. I've always known since I was in my teens that I had something wrong with my thyroid, just because it's been in my history, my family history. My twin sister has thyroid issues, but going to Kaiser, it's always like, oh, you're normal. But through the extensive testing that I've gone through with Dr. Mortensen, that was validated. And so my thyroid functioning has improved significantly. It's definitely moving towards where I want it to be. My cholesterol and triglyceride ratios are within the healthy range, and my goal is for it to be in the optimal range. Stomach issues have significantly decreased. Now when I have prior to seeing Dr. Mortensen, it was constantly kind of like controlling my life, you know, where would be the next bathroom. It was always kind of like, I have to go. There's like, it was always urgent. Now, even my husband on long drives to San Diego, he would be like, you didn't even ask to go to the bathroom. It was always like a part of our life. So my energy has definitely increased. I don't need as much sleep in the day. If I take naps, it's super short, maybe like a true power nap, like 30 minutes long. Before, it would be like 3 hours after work. I can't function. And so, you know, now after work, I'm able to, you know, get things done around the house, go on walks, cook. So there's just a lot that I can do throughout my day, even after work. Yeah, I feel like I just want to say more because I feel like, yeah. And I asked him, I'm like, how do you deal with being very patient and kind of holding back? And I'm really, with people that I talk to, I don't try to sound preachy because I know that turns people off. But as the doctor, like, how do you just like, yeah, this is what I know, and then kind of pull back and not try to be like, you know, like, I just want people to get well now, you know. And I know you know, my husband's always like, it's like you're trying to, you know, convince them that you're right. I'm like, I know, I need to pull back, you know. So I just get kind of, yeah, I know people make their own decisions, but I'm like, just do it. It works, you know? And that's what I have to tell my husband, like, even being so overweight, like our bodies do such a great job with adapting that like 214 pounds did not feel like it. Now I look at it and it looked like a lot, but my body adjusted, like, you know, and not being able to reach over, that was normal for me until like I'm here. I'm like, holy cow, like I'm doing things. I didn't know that wasn't normal. I just got used to the discomfort, you know? I also want to point out, like, after healing, how do I word it where it's like, it wasn't like, oh, other things just got worse. It was like, after I started healing and things started to like get better, my eyes like opened up to like other things that were going on. And that's how like the weight loss started. So does that sound right? Like, it wasn't like more problems occurred. It was just like something kind of like lifted, and I was kind of, oh, I didn't know that was, you know. Prior to all these changes from healing my body, prior to all this, I could eat probably an 8-ounce, and that's being very conservative, an 8-ounce ribeye with the sides, with the rice, with drinks, to now being able to eat barely 4 ounces of a ribeye steak alone. So my hunger and satiety levels have completely improved, where I'm not eating 6 times a day plus a sugary latte. The biggest tip I would recommend for a new patient would be to do all the recommended testing. The information you will get will definitely help you understand what your baseline is, but also it'll be information for you to use as you go through your health journey and see the improvements that you're making for yourself. And that's what will keep you motivated, is having that objective data. But the doctor won't make you do anything. And my biggest regret is saying no to one test, the hormonal testing at the very beginning, because now I don't have like a baseline of what I was before. But I think I've done most of all that he's recommended, and I'm so grateful for them. It's like, it's amazing from like the first time I saw him, like the first test was March 2020 to now. It's like my cholesterol and my A1C, like I started at 5.9 at Kaiser. I actually have my paperwork from Kaiser, and they have me on pre-diabetic range, but of course they can't do anything. So I'm like, how long have I been like in this range? And so that 5.9 to like my last was like 4.9. Yeah, significant changes, even with my thyroid. Yeah, so that's why I keep going. Like, it's getting better. And if you don't have those numbers and you're just kind of I was just guessing, it would be hard to feel encouraged to keep going. But every time something would get better, it just pushed me to continue to just doing what I was doing. What I would tell someone who is new to seeing Dr. Mortensen is to not hesitate asking questions, to be prepared to give him a full description of what's going on, from like what's going on currently, and anything that you think was strange but maybe not so serious. Like, make sure to tell him everything that has happened in your health history for as far back as you can remember, because it will be all part of the puzzle of what's going on presently. I would also recommend people coming in for the first time to be coming in with an open mind. The things that you will be asked to do, or it would be a suggestion or whatever, might be completely different from what you've been doing through conventional medicine. It might be strange that it's going to be a lot of testing, and for me, I was not used to all the testing, because at conventional medicine, it would be like just a few biomarkers. Where testing here, you're going to get pages and pages of information. Because there was like a time where like I was really like resentful and angry because I've wasted so many years, and Dr. Craig is so sweet. He's always like, you're young, thankfully you're young. And sometimes I feel like 20 years of like knowing there was something wrong, like, and I'm not the only person, and I felt resentful towards like, Kaiser type doctors. But I had to heal from that, and I'm constantly watching like different functional medicine doctors, and he's explained, it's just the way that they're taught, it's different. And they're not, and even my husband's like, he's just like, so angry towards doctors, and I even tell him, I'm like, they're not meant to hurt us, they're just doing what they're taught. Because he's just like, oh, they hid all this information from us. I'm like, I don't think it's that sinister. It's just that you're taught one way. And one thing I would like to share with people, especially with my story and people who have seen the weight loss, that I had to get healthy to lose weight and not the other way around. Focusing on proper nutrition, supplementation, testing, being open to a different way of healing was what got me to the point where people see the physical outcome of the 100-pound weight loss. But it was truly just doing all those things first, and then the weight just started to melt, because my body was finally doing what it was supposed to be doing. And I do want to point out that like his work is like affecting so many people, not only me. My mom, my aunt has come in to see Dr. Craig, and it's like this, like everyone's like, at first when I started, they're like, oh, what's this weird thing, weird doctor? Same person saying the same thing a year and a half later is like, what's your doctor's name? And asking for the information. So his work is truly just like working through him, like without me having to say much, is really affecting other people. He's so calm and so not like how I would, if I was in his position, I would be like, you gotta change. And so it like, it's so gentle, and my husband's the same way. Like he's such a great influence, very like a gentle like leader, where you watch through model, or like through like giving people space and not being judgy. So I feel like I'm just gonna do it, and if they're gonna ask, then I'll tell them. And that's how it's happened. Like, how are you getting better? Who's your doctor again? Like it's like, what's a functional medicine? Even though I've told them at the beginning. My mother-in-law pulled me into a family party with all the aunts and uncles, and she just sat me and Christian down and like, tell them all about your doctor. And they're like, where is he, la la la. And then my father-in-law calls my husband, and he goes, you all were like the talk of the town at the party after you all left. And my husband's like, so what are the aunts and uncles going to do about it? And I'm like, I don't know. I don't think it's too late. I think we planted the seed, and, you know, hopefully we're modeling, you know, good health, and that's enough